Hi, everyone. Welcome to the 2024 research convening of the Center for Victim Research. We are going to give people a minute or two to get in and settled before we get started. So just hang tight for one more moment. All right. I know everyone is there's some people still trickling in, but we will let them go ahead and do that while we get started. Welcome to everyone who joined us already. My name is Mallory Dusenberry. I am the Associate Director of the Center for Victim Research and also a Principal Policy Associate at the Urban Institute, where I conduct victimization-focused research, evaluation, and technical assistance. We are so glad that you took the time to join us today for CVR's research convening. We will be discussing strategies and challenges related to conducting research on and with hard-to-reach victim populations. We have a great agenda for you and some wonderful speakers, but before we get underway with the main content, I'm going to spend just a few minutes going over some logistics, background, and context. So as you may have seen, we are recording the opening session of today's event, and you will receive an email with a link to the recording and the slides. We will later be splitting into networking and discussion breakout groups that will not be recorded. However, we will be taking high-level general notes that will inform a forthcoming write-up of the event. We request that you stay muted unless participating in the audience Q&A and the breakout groups. It is totally up to you whether you share your own video at this time, but it would be really helpful if you could make sure your first and last name are showing, which you can do. You can rename if needed by clicking the three dots in your corner. We also encourage you to open up the chat box, which you can do by clicking the chat button at the bottom of your screen. And note that you have choice of the recipient. So please direct public questions and comments to everyone, as we will have multiple people monitoring the chat. You can use this feature to ask questions, share examples from your work, and post comments at any time, keeping track of them. And if your questions are not answered immediately, we will raise them during the Q&A portion of the event. And let's go ahead and get that chat going now. Please feel free to share where you are joining us from. For example, I'm speaking to you from my home in an unseasonably warm Washington. So as those roll in, I am sure to be seeing representation from all parts of the country, which I think is so exciting today. You are also more than welcome to use the reactions feature to respond throughout our discussion. And then lastly, we will share a link to an incredibly brief feedback form at the end of the event that we heavily encourage you to fill out. You can also use this form to request a certificate of attendance if needed. And we want to emphasize that live captioning from a CART professional is available today and can be accessed by clicking the CC button at the bottom of your window and then show captions. And I believe my colleague is also posting in a link for you to see that in a separate window as well. All right, and for those of you who are new to us, the Center for Victim Research is a national resource center that aims to bring victim researchers and practitioners together to improve response to victims. CVR is a joint venture of the Justice Information Resource Network and the Urban Institute, and we are guided by practitioners through our community work group. We offer an extensive victim-focused open access research library, a collection of validated instruments, original tools to support research, and victimization-specific research syntheses. We also try to foster research collaboration or general collaboration through a searchable researcher directory, which currently has almost 400 members and counting, so please join if you're not already in it. And we uplift researcher practitioner partnerships through fellowships, podcasts, and webinars. And then you'll see on all of our slides our email or website address there, victimresearch.org. Now I would like to pause here for a brief moment to thank our funder, the U.S. Office for Victims of Crime, for their ongoing support, and give the standard disclaimer that the opinions and findings expressed today do not represent those of the U.S. Department of Justice. And before we dive in, I want to do a small bit of framing. I think we can all agree that the primary goal or a primary goal of practitioners and victim researchers alike is for systems and services to work for all crime victims, meaning to do no additional harm, to meet their diverse needs and contribute to their recovery and empowerment. And as victims are not a monolithic group, this is a significant challenge. And research plays an essential role in illuminating whether these responses are working and particularly for whom. Many researchers, including many of us here today, have worked to illuminate victims' preferences and barriers accessing both community-based and system-based responses. And many of these preferences and challenges are connected to aspects of victims' identities. Common examples include challenges communicating, whether due to language, technology, or disability, isolation of individuals or entire communities, and lack of trust of professionals. These same barriers that keep many from being able to access the care they need also makes it harder to engage them in research studies. Yet we're all here today because we know it's essential to fill these gaps and include victims' voices in meaningful ways to ensure that policy and practice is responsive to all those in need. Today, we hope to share some of the exciting research that is being done and facilitate thoughtful discussion as a large group as well as in smaller groups about strategies to engage in work that specifically targets some of the most hard to reach victim populations. However, we also want to emphasize that the groups we'll be discussing today are not the only hard to reach victims, nor do these groups exist as distinct communities. We want to acknowledge that, like everyone, victims' identities are complex, and services and research alike must approach them with an eye towards intersectionality. And we hope that this event will enable discussion of the ways in which strategies and challenges to engage diverse populations are similar, where there are common strategies, and therefore what we can learn from one another across areas of focus, but also in what way certain populations are unique and how we can tailor responses accordingly. So to accomplish these goals, we will begin with a panel discussion with 3 researchers capturing diverse victims' experiences and perspectives. We will then give time for you to ask questions of the panelists by raising your hand and coming off mute or via the chat box. Next, you will have the opportunity to join small breakout groups to share your work, meet other researchers and practitioners with similar interests, and discuss the topic further. These sessions will be led by expert discussants and co-facilitated by CVR staff. We will reconvene and conclude by presenting key takeaways from the day and share some additional CVR resources. So without further ado, I would like to introduce our panelists. I am pleased to be joined today by 3 outstanding researchers who have a wealth of experience on different victimizations and populations. Dr. Mary Breaux is a professor of practice in the Department of Victim Studies and the director of the Crime Victims Institute in the College of Criminal Justice at Sam Houston State University. Dr. Breaux's research focus is child abuse and neglect and elder mistreatment. She also brings nearly 20 years of practical experience working with the Texas Department of Family and Protective Services in areas such as community relations and engagement with adult protective services, case management with child protective services, training, and human resources. Dr. Carlos Cuevas' research broadly covers the areas of victimization and trauma, with a focus on hate crimes, sexual violence, dating violence, and family violence. Much of his work centers on examining victimization among understudied and hard-to-reach groups, such as persons of color and LGBTQ plus people, and how that relates to psychological outcomes, service utilization, and the role these cultural factors play on victimization. As a licensed clinical psychologist, he also provides assessment and treatment to trauma survivors and victims of violence. And last but not least, Katie Edwards is a professor at the University of Nebraska-Lincoln, where she directs the Interpersonal Violence Research Laboratory. Much of Dr. Edwards' work focuses on Indigenous youth and families, as well as sexual and gender minority youth. Using community-based participatory action research, Dr. Edwards seeks to answer two main questions. One, how do we prevent sexual and related forms of violence? And how do we most effectively support survivors in the aftermath of violent victimization? So I will leave it at that because we're about to hear from them directly, and I will stop sharing my screen for discussion. Okay. All right. Has it stopped sharing? Can anybody confirm this for me? Okay. Okay. All right. And let's go ahead and I want to start by asking each of the panelists to share what research they have conducted on their victim population of focus and what makes victims with those identities unique. Dr. Cuevas, would you begin?
Sure. Thanks for the invitation. This is great to be here and sort of talking with folks about the sort of challenging issue. So I have spent a long time. I want to say it's almost 20 years now, primarily doing a lot of research with the Latinx community. This is probably going back to the mid 2000s. Really sort of looking at various different forms of violence. We've done work looking at sexual violence among Latino women, dating violence among Latino youth, and then more recently projects that have focused on the impact of hate and bias-motivated violence targeting Latinx adults. And one of the things that I think has been interesting in terms of the population and the sort of the methodological approaches has been that depending on the project, we've had a lot of sort of different approaches in terms of how we've recruited participants, how we've sort of collaborated with the community in doing these projects. And really sort of I think sort of there's been sort of this trajectory of shift in terms of how we have worked with the community to sort of be able to sort of answer some of the research questions we've been focused on. Some of the earlier projects, we actually did random digit dial surveys, which for those of you probably under the age of 30 are wondering what that is. And really sort of had a much more sort of kind of nationally focused approach to recruiting Latino adults. The more recent projects, we've really been much more embedded within the communities and collaborating with community agencies and different stakeholders to recruit participants, where the focus has been on the impact of hate and bias-motivated violence towards that community. I think the sort of one of the key factors around recruiting and working with this community has really been the degree to which you can sort of have some degree of connection and trust with the community for the purposes of research. The more recent projects, we've sort of gone out to community agencies, gone out to festivals, sort of actual sort of community-based events as recruitment opportunities. And that really, I think, it sort of gets people that sort of feel that we're actual people, they can trust us. We have, a bilingual research team. And I think that makes all the difference in the world in terms of people feeling comfortable doing the surveys, primarily because, we're asking about sensitive topics, we're asking about victimization experiences, and two, particularly probably in the last 8 to 10 years, really a sort of heightened degree of distrust from that community to the government, any sort of formal agencies, and sort of it's hard to sort of get buy-in if they don't trust that you are who you say you are. And I think that's been really key in terms of our presence in the community, our collaboration with community partners, so that people feel like, okay, we know who they are, we know where they're from, we know what they're doing, and they don't sort of, they're not clicking on sort of just like a random link on social media or something. And I think that's been really central to recruiting a community that historically has been a difficult to reach, difficult to retain population when it comes to sort of research work. So I think that's probably been sort of some of the key things in terms of the community that I've worked with. Certainly within that community, issues of immigration have come up, issues of documentation status come up. They're all very sort of sensitive topics that we ask about. And again, that trust, that connection, that presence has been a big factor in allowing us to be able to do this work.
Okay, we had one quick clarifying question from the audience to explain who exactly the Latinx community represents, as that is a new term for them.
So without going into a 2-hour discussion about which term to use, if you're Latino or Latina, you say Latino, Latina. We have been asked a lot in manuscripts and in research publications to use the term Latinx with an X at the end to be more inclusive, or the term Latina with an E at the end to also be more inclusive. Both term Latinx and Latina are ones that have been more recently getting used because they're non-gendered and more inclusive. I have tended to default to Latinx and probably will use that one more sort of frequently in this type of setting. But admittedly, I will probably flip back and forth because I'm Latino and bilingual, and we'll probably use all four of the terms somewhere along the way. But really, it's more terminology that gets used, again, primarily in more sort of academic settings, with the intention of being more inclusive of sort of, everybody in terms of race, background, gender, so on and so forth.
Thank you so much. And Dr. Breaux, we'd love to hear from you next about your work.
Yes. Thanks for having me. My prior research pretty much focused on working indirectly with child and adult abuse victims. Now, these two populations are considered, of course, a hard to reach population because of the challenges gaining access to them. As many of you know, attempting to gain this access, especially for children, for research is very challenging because they're still minors, number one, and often attempting to get access through community or state organizations, you must consider confidentiality issues of child victims. With older adult victims, you also deal with confidentiality issues of the child victims. And with older adult victims, just trying to get specifics within organizations, there's so many restrictions of gaining access to them, especially if you want to look specifically at a specific geographical location of the adult victim, or maybe you want to examine a specific type of elder abuse. Often you run into those challenges and barriers of attempting to get access from community organizations or state organizations. But for my child abuse victim research, I focused on child emotional abuse as it relates to teachers reporting this type of abuse to the appropriate authorities. So in this case, I was only attempting to get access inside the classroom. But of course, I had to get approval from, school districts. And within those school districts, I had to get approval from the schools and then the principals. And it was just like a trickle down theory. So eventually, I got approval to speak with teachers to basically be the voice for those child victims. With any type of victimization, it's very sensitive. And when you have sensitive issues that arise, there's always, you always have to be very careful with your research. The elder adult victim research was a collaboration between several elder adult expert researchers that I had an existing relationship with. So this assisted me with the access to them. However, had I not had that existing relationship, the partnership may not have happened. So I'm a firm believer in building the trust with community partners that actually target these particular sensitive types of populations, specifically child abuse victims and elder abuse victims.
Wonderful, thank you. And Dr. Edwards, would you like to go next?
Sure. Thank you again for having me. As was previously mentioned, my research focuses on the prevention of sexual and related forms of violence, as well as supporting survivors and their recovery and healing processes. All of my work is participatory action, so really deeply community-led. And all of the work that we do focuses on structurally minoritized populations. So most of our work right now is with communities of color, especially Indigenous communities, as well as LGBTQ2S+ communities. And, you know, it's always interesting because I tell people I wasn't really trained in graduate school on participatory action research or really on doing work with some of these specific populations. But I've learned a lot as I've started working with these communities, and often say that I've learned more working with these communities than I ever could have learned reading a book or doing a project in grad school. And so for that, I'm really grateful. It's interesting too, kind of how I found this work. I'm part of the queer community, and so there was always an interest in doing things to better my community. I'm not Indigenous, and it's a long story, more than the 6 minutes I have here to tell you how I got here. But I will say that I really had to do a lot of learning and a lot more listening and a lot less talking. And I think that relates to the overall question here about some of the unique challenges of doing work with these populations. Like the other panelists have talked about, within Indigenous communities too, there's a long distrust of researchers, as there should be. I mean, there was really horrific types of research without consent, research that was really damaging and dangerous that was happening with Indigenous populations. And then ongoing legacies of colonization, multiple historical traumas, which we know have led to many negative outcomes, and also understandably distrust of researchers, particularly outside researchers, which is why participatory action research is so critical. I think that in addition to that distrust, there can be shame and fear, and also accessibility. So a lot of the work I do is with highly rural Indigenous communities where, you know, you may have to drive 2 hours to get to do a survey, or 3 hours to do an interview. And so that can really make research hard. And I know a lot of people do research online, but for a lot of our work in Indian country, that's maybe just not even accessible. So, you know, expecting someone to have Wi-Fi and a device that they can do this on wouldn't always be the reality. And also too, we found in a lot of our work that oftentimes doing surveys on paper and pencil, or even more so having conversations, is a more acceptable method. Within LGBTQ+ communities, again, I think with all minoritized communities, there can be a distrust of researchers, especially researchers coming in from the outside, but even within the community. So, you know, there's a lot of diversity within the LGBTQ+ community. And so I think really making sure that you have members of that community and diverse members of those communities helping to co-lead this work is really, really critical. I think some of the other challenges with doing work with queer communities is, you know, concerns about reifying stereotypes that have been really harmful and damaging to the community. So a lot of research has focused on deficits as opposed to strengths. And the last thing we want to do is use research that could inform policies or practices that could be harmful or damaging to communities. The other thing that we know it can impact participants who are part of the queer community or communities is they may not be out. And if participants are not out, participating in research may not be safe for them. So those are just some of the things I think that make these populations unique. Of course, these are kind of quick and simplistic explanations, and there's a lot of other things going on like intersectionality and systems of oppression that I think really can help us to even understand and unpack these further. And I just want to mention, again, the importance of capitalizing on strengths. We always contextualize experiences of violence within systems of oppression when working with minoritized populations. So for example, with Indigenous populations, we conceptualize violence within the legacies of colonization, multiple historical traumas, structural racism. With queer populations, we talk about minority stressors, so those that are more distal, like policies and practices that are discriminatory and harmful, and then how those can impact a person's perceptions of themselves. And so when we're really thinking about those population-specific theories and experiences, that can help us to also amplify strengths and to not put the burden of the blame onto this group of people. And again, I think that context really fits with participatory approaches, which I know I'll be sharing about later more when we talk about approaches to this work and overcoming barriers. Thanks.
Yeah, thank you so much. Yeah, I'm sure I speak for everyone when I say that you are all doing incredibly interesting and important work. And yes, this is a mere 2 hours and to talk about incredibly complex issues and challenges. So yes, sorry we can't give more time, but we're so grateful to be having these conversations in whatever capacity we can now. And actually, that is how you ended was a great segue to our second question, which is really diving in a little bit more on how you've included the voices and perspectives of these groups throughout your research process. And Dr. Edwards, we can kind of kick it right back to you to continue that thought.
Sure. So again, the work that we do is deeply participatory. And by that, I mean that we have community leadership in all phases of the research. So from the beginning to what do we want to understand better? What do we want to research? How do we want to research it? To how are we sharing those findings, contextualizing those findings? That there's community leadership at every single step of the way. And values of participatory action research are super important. So shared power, reciprocity, humility, respect, transparency. And on our teams, we always say having a good sense of humor goes a long way too. And these are really, really important values that I don't know that are always part of different kind of paradigms and ways of doing research and being. But they're super important, I think, when working with minoritized populations. And really working on approaches that are empowering survivors and empowering minoritized individuals to have agency in their own lives and to dismantle systems of oppression. And so when I say including partners, that's happens in a variety of ways. So we have community advisory boards. Just last night, we had a community advisory board for one of our projects that had youth and caregivers here where I am right now on the Pine Ridge Reservation, where we really spent time with them, really co-creating the curriculum that we're going to be delivering, for example, so that their voices are part of everything that we're doing. In addition to highly engaged community advisory boards, we hire within the community so that all the research that we're doing is coming from within rather than without. So all the programming that we do is taught by people that are with it from that community. So for example, I'm on Pine Ridge right now, and all the programming that we do here is taught by Lakota instructors and program facilitators. The research that we do is collected by Lakota research staff. And our online interventions with queer youth or our online research, that's all done by queer individuals as well, along with a queer youth advisory board. So those pieces, I think, are really, really important in centering the voices of your populations. And it really helps a lot with recruitment and retention. We do a lot of door knocking in our research, and having someone from outside the community who doesn't look like you, doesn't talk like you, knocking on your door may not always be the most successful approach. And so we, again, really rely on local community members to do that. And having community champions, I mean, that's super important too. So having leaders in multiple subpopulations within your community, be part of your advisory board, be on your staff, be a consultant, can be really, really helpful too. And research with Indigenous populations, tribal IRBs also provide input. So they're also really a key part of the work too. And then that dissemination, so including the voices of the people who you've worked with. So of course, staff, but we also do like member checking with participants. We always, at the end of a study, will have a community report that we give to our participants. And if it's been an in-person community as opposed to an online community, we'll actually invite people to come together to have a meal, and we'll share our findings with them for feedback. Also, our community partners co-author papers with us, including publications, so that their voices are really at the center of those. And they may not be, sitting behind a computer typing, but they may be sharing those stories and their wisdom about what we found and what we should do with it. And then we're the ones integrating that into the paper. And I will say today is a little bit unusual. I pretty much always present with the community partner, especially our work in Indian country. I know this panel is set up a little different, but I do have an elder here who's here, Mona Harrington, who will be joining our breakout session. And then two final things, partnering with agencies is really important. So like right now we have a study on the sex trafficking survivors. So we've partnered with a lot of agencies, domestic and sexual violence shelters, shelters and agencies that serve houseless relatives. So we're really partnering with them, but we're also out in the community. I mean, Mona, who's on this call now, is, going to different parts of the communities to share information about the study. We go on radio shows, we go on to different community events. So I think those are different ways to both find individuals who may be willing to share their stories, and also really making sure that you have diverse voices and perspectives from within a community in your research. And I'll go ahead and stop there.
Yeah, thank you so much for that. And Dr. Cuevas, would you like to share a little bit more about your efforts to include those voices and perspective? I know you already talked a little bit about your presence in the community, but I'd love to hear some more.
We've only been doing this for 5 years, and you think I remember to unmute. So probably a lot of what I'm going to say is going to have some overlap with what Katie was just saying. I think one of the things that is sort of in the background of this idea of how we include the voices of the community is that, again, particularly with the Latino community that I've been working with, there's just a immense diversity within that community. Not just in terms of sort of ethnic background, racial identity, sexual orientation, gender identity, but also in terms of whether they're an immigrant or not, their documentation status, their degree that they've sort of been acculturated to the U.S. culture, or whether they're much more connected to their culture of origin. And so part of the importance of including that community, the sort of including the voices of the community, is that there's going to be lots of different voices and a lot of diversity there. So we've done a number of things across our projects that have sort of really been a focus of this. And I'll mention a few in sort of no particular order. One is actually something that Katie also mentioned that we have here, which is a community advisory board. And the community advisory board that we have is a community advisory board we have had for, I think, almost 20 years now. That is a community advisory board that is part of our research center. So we have had a long-standing relationship with this community advisory board, and they represent all different sorts of communities, sort of in the greater sort of Eastern Massachusetts, Boston area. Community agencies, youth serving agencies, representatives from the city of Boston, representatives from the courts, Boston Public Schools, Boston Police. And so we've had sort of a long-standing partnership with our board that really has made it that we are in one way sort of always constantly connected to the community and sort of different parts of it and different sort of groups. But also that's really sort of allowed us to have a really sort of collaborative approach to a lot of our research projects and the development of those projects, whether that be feedback that we get from the board directly or recruitment opportunities that come because of our board. Those are all things that, are sort of been longstanding. And so it's been immensely useful because if not, the process of building that relationship with the community and sort of being able to sort of bring out their voices, bring out their perspective, that requires time and trust. And in some ways, because we've had our board for so long, that's kind of really built in for our center, and it's really sort of been sort of very kind of fruitful and helpful to us in our work. I think there's a couple of other sort of important things. One of them is that we've done a lot of focus groups in the development of our projects. So, whether it's drafting our instrument or recruitment or whatever, we actually have had focus groups very often just to get feedback from the community before we even go out there and do anything. Sometimes it's feedback, sort of the nuts and bolts of the research. Hey, the way those questions are worded don't sound right, or, your translation sounds a little too insert Spanish group here. And you sort of have to try to find the neutral terminology for some things. And sometimes it's just to hear from the community about, kind of what's been going on out there. And the more recent example, again, was getting some feedback from community members before we went out in the field with the hate crime project. And one of the things they brought up was, this was a time, sort of a couple of administrations ago where there was just a lot of fear in the community. And they said, you're going to have a hard time. You're going to have a hard time getting people to trust that you're legitimate and not, out to get them. And so, we're out there saying, hey, we have an NIJ funded study. That wasn't something that was necessarily going to sit well. And so really, being present at the agencies, being present at, at just about every other food festival that there was that summer, which was none of my grad students complained about that because it's hard to be upset about recruiting while you've got a mouthful of chicharron in your while you're out there. And so it really made it that our presence in the community, the fact that we had predominantly our team was bilingual, bicultural, really was a key difference in having people feel okay with participating in our research. The other way that we sort of incorporate the community is whenever we do these projects, we always put out a sort of brief, sort of, 2-page succinct graphic sort of little summary of the research, because the reality is, we go on, we write, manuscripts and papers about this research, and the only people that read those are other people who need to cite the research to write their papers. So we mass distribute these really brief summary pamphlets to people working in the community, agencies, anybody who's willing to hear it. We're happy to share it, so that it can really kind of get back to the community and actually be used by the people who are working in those communities. I always tell people, we'll take our little presentation about the project to anybody who is willing to listen. And so a lot of times we're, right back to those same communities, those same agencies that we work with to recruit participants, to then present to them about the project, what we found, in a very sort of applied way that can be useful to the community. Particularly the more recent project where we're focusing on hate and bias-motivated violence, there was a lot of things we were going back to agencies and saying, hey, this is what's happening. This is what we're seeing from our research. This is what kind of we saw. Here's that information to sort of help you work with those folks. The other piece that I think is really useful, and I perceive this by saying that I've always been a sort of a very quantitative person, is that most of our studies are mixed methods. And so there's both a quantitative and a qualitative component. And the qualitative piece is really great at getting sort of hearing the voices, hearing the perspectives of individuals, because it really helps us contextualize whatever we might be seeing in the numbers. The qualitative data really helps contextualize that. And it really helps us present sort of a more, in some way, sort of personal and sort of real world perspective of what's happening in those communities. And the interesting thing is that, the both sort of approaches are incredibly complementary of each other. But it's great to be able to talk about our research and give those sort of pieces from the qualitative work that really highlight what our results are, what we're seeing. And so, we saw a lot of people sort of, unwilling to report to formal authorities around their victimization experiences, particularly around hate and bias motivated violence. And one of the stories that I always like to tell is that in one of the qualitative interviews, this woman came and said, hey, yeah, now she had already done the survey. She had scheduled an appointment to do our qualitative interview. And she said, yeah, my friends keep telling me not to come to this because they thought that this was an ICE sting operation. And it was just such a great way of highlighting why people weren't coming forward, why people were just sort of having these negative experiences and just sort of sharing them within their community, but not speaking out about that, not reporting it because they were fearful. Now she'd met us. We were in person when she did the survey. And she still was sort of like, yeah, my friend said, I don't know. And I don't know, I never thought this face gave off, ICE sting operation vibe, but it was really highlighting the fear in the community that you really didn't pick up or that you saw in the numbers, but didn't really sort of, have a nice, clear way to articulate that. And so the qualitative piece has been a great mechanism to really highlight sort of the voices and the perspectives of the individuals that we've been doing work with.
Thanks so much. And as a largely qualitative researcher, I love to hear the emphasis on mixed methods and qualitative data collection. Dr. Breaux, I'd love to hear from you next.
Yes, totally agree with Carlos with the qualitative piece, because when I looked at child abuse and neglect, I looked at it from a qualitative standpoint within the classroom. So essentially my research focused on being the voice for victims, specifically child abuse and neglect victims. The research that I have conducted was, again, as I mentioned earlier, within the schools. And I could only access the voices of the students through the teachers. So I couldn't directly speak with the students. So my research focused on interviewing teachers who did or did not report or even recognize child emotional abuse or neglect, which is an area that mental health specialists would have to designate anyway. But it would be up to the teachers in this particular, in mandatory reporting states to report it anyway, any type of suspected cases of child abuse and neglect. So I examined what the teacher's observations of the child's behavior and demeanor was in the classroom, and kind of looked at key indicators from their observations, such as, emotional responses, behavioral changes, academic performance, things like that, of the teacher's child's behavior and demeanor, specifically in the classroom. I really wanted to know the needs of the child, basically, but I had to, again, speak through the teachers of whom I did have access to. So I depended on them to be the voice of the child, because I wanted to ensure they were receiving the support they needed, emotional support from the school, community support, or any other needs that they possibly needed. And ultimately examining if teachers were, or exploring if teachers were reporting this particular type of child abuse. And with the elder abuse victims that I mentioned earlier, same issue again, challenges gaining access to these particular victims, but the study was conducted with a team of researchers who already had access to this population. And I think one of the other panelists mentioned this, the relationship did take years to build. It took a while for them to establish rapport with this huger or larger state organization, but they did it. But it did take time. It did take trust. I mean, they had to build trust to actually get into this organization. So we had access to be the voices for this elder abuse population that we were actually looking at. And the study actually explored elder abuse victims' satisfaction within the community and state organization, and with the provision of services and resources they provided. So essentially looking at or asking them, were they really satisfied with the resources and services provided to them? That's what was the whole gamut of the study. But again, if I did not know those community partners or had a relationship with them, I probably wouldn't have gained the access that I had to these particular victims to even assist in this particular research project. So again, qualitative research, I do believe that that brings out the voices for the victims that you are researching. And I believe that with the qualitative research, you actually hear their voices through your research. So most of my research have been qualitative research.
Okay, thank you. So you've identified a number of challenges already and some of the ways that you've navigated those, but I want to give you the opportunity to give any other kind of key challenges to working with the populations that you study, and some space to talk about how you've overcome them and what other strategies that you haven't already shared that you've employed. Dr. Breaux, would you like to go first for this one?
Sure. Okay, I want to make sure I wasn't on mute again. Okay. Again, I can't stress this enough. With children, child abuse victims, of course, the biggest challenge is gaining access to them. At least for me, that was the biggest challenge that I had. You can gain access to information regarding them through like data sets, information about them. But when you're attempting to work directly with them, there's just not easy access for numerous reasons. Ethical considerations, meaning you have to make sure that their protections are protected. I mean, children's rights and the welfare of children are protected. And prior to even starting my research, I had to, of course, craft my questions to the teacher participants. And I'm going back to the study I did within the school that related specifically to the children in the classroom to, again, hear their voices through their teachers' voices. So that was kind of a challenge because you're asking teachers specific questions that you kind of want to know the answer to, but the crafting of the questions was a challenge because I was really trying to pull those voices, the voices of the children out of the teachers, since I couldn't directly talk to those child victims. As it relates to adult victims, again, partnerships, and I keep stressing that, I guess, because I'm a former practitioner, partnerships with existing organizations that target those particular populations or work with them directly or indirectly, was something that worked for me. Again, fortunately for me, I was a former practitioner. So working in the field, I had specific contacts that I could actually go to. And I think that helped me that was a workaround challenge for me, working with that population. So I really, really took in consideration community organizations and agencies who work directly or indirectly with victims, and tried to establish those partnerships. And I think today, when researchers are trying to get into these hard to reach populations, I think kind of partnering, building trust, building that rapport with organizations, a reciprocal relationship, I think that really, really assists researchers into gaining access to these hard to reach populations.
Thank you. And Dr. Edwards, are there any other challenges that you've had to overcome in your work?
I think just a couple things I'll mention. So I think one of the challenges that we have faced, and anyone who does online research can probably relate, is, I mean, we faced, issues with fraudulent responders. And so I think that's something that we've had to, grapple with. So, we have a study, for example, of it's an NIH R01 of online, it's an online study of sexual minority men, and which our sample size is 3,600, but we've had over 50,000 people try to get in the study. And so, and that a big piece of that is on recovery and healing among survivors who are queer men or male identified. Anyway, so that's a challenge, because right, if you think about like the implications, right, if you're not catching fraudulent responders or identifying them, how do the implications, right? Like if we're drawing findings from this and saying this is what we should do. So we have really rigorous protocols in place. Happy to share those with anyone who's interested, so that we can identify and remove. And at the same time, do it in a way that's trauma informed and not policing of identities. I think that's something else we've had to be, really thoughtful about. One of the other, I think barriers, just that we already talked about a lot, is in our work with minors, particularly LGBTQ plus minors, who aren't out, or maybe who are, not connected to their caregivers or guardians. And so in that research, we've always requested and been able to receive waivers of guardian consent, which is really important, because if we had to get guardian permission, we'd be excluding them, the vast majority, if not all, of youth who are not out, which are a substantial number or percentage of queer youth. And so I think those are just some additional challenges that we grapple with, and putting safety protocols in place, for if a parent is angry that their child's in the study, or finds out that they're outed through the study, or because the parent finds an email from us on their device. I mean, we ask for every safe methods of communication and things like that. But so yeah, if anyone's interested around those protocols, happy to share, because I think these are things that other researchers are likely grappling with too. So thank you.
Yes, definitely resonate. All those challenges resonate with me, and I'm sure many others. Dr. Cuevas, what would you like to add?
Sure. I mean, I think, like Mary said, one of the things that we also sort of had to do a lot of work around is the issue of access and recruitment in the community. The partnership with agencies have been a huge help. But there's I don't know how much of it is so much a challenge at this point, but more just the sort of the labor and deliberateness of reaching out to the community, sort of being out there with them, and really sort of help the recruitment process, so that they sort of trust who you are, your legitimacy, and all that. So that's been one piece that is a challenge, no matter how, we've done this a number of times, no matter how many times we do it. Yeah, we've got more of a relationship now than we used to, but it's still sort of, there's the labor of sort of going out there and doing that. The other thing, there's sort of two other key things that we run into, that some of it is unique to this community and some of it is not. But the one that's unique to this community is the issue of instrumentation, translation, and sort of the need for bilingual surveys and bilingual staff. The last hate crime project we did, which is a few years back, a lot of our graduate students who are integral in doing this research were bilingual, bicultural. We don't have as many of them now. And that really presents a challenge, because we want to be able to, connect with participants in whatever language they prefer. And so having bilingual, bicultural staff is actually really important for the work we do. Translating things in a way that works for everybody is also really sort of kind of important. One of the things, and again, to any of you who are familiar with this work, or any of my fellow Latinos in the audience, will know that you've got a lot of regional linguistic differences. There is the story I like to tell is that when I used to be a social worker before I went to get my Ph.D., and I had a client who was talking to me about, sort of, we were finishing the meeting and I was about to leave. And again, I'm a child protective services worker right now. And she says, yeah, no, the other day, the way she phrased it sounded like she said, and it was in Spanish, she said, perdí la guagua, which to a Chilean means you lost the baby, because guagua is a slang term for baby. If you are from Puerto Rico, which is where she was from, Wawa is a bus. Needless to say, the look on my face when she said that was much more alarmed than she was expecting, because all she was telling me was her trouble missing the bus the other day, and I thought she had misplaced her child. So you want to be able to translate things in a way that everyone will understand. And again, to my fellow Latinos, if I tell you that I'm Chilean, you'll probably have some joke about the fact that we don't really speak Spanish to begin with. And that's actually difficult. There's a lot of diversity in the US Latino population. And so doing the survey in a way that sort of lands for everybody can be a challenge sometimes. And sometimes we have questions where the question is a certain number of words in English, and the Spanish version of that question is blah, 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 slash this, because we're using every terminology that every different group might use for something like that. And so some of those things we've gotten better at, but there was a lot of work to go into how do we write this? How do we give every language version we need in a way that's going to essentially be asking the same question? And that can be really tricky sometimes. And we actually, when we talked earlier about getting feedback from the community, we actually get a lot of feedback from people, other folks on our research teams, that really sort of helps us craft something that everybody will understand. And so that's been another piece that I think is really sort of crucial that's really unique to sort of doing any work where you're working with research where you're needing to do things in multiple languages. That's always going to be a challenge in a way that you'll be able to sort of trust your data. And the importance of having culturally informed bilingual research teams is really sort of a big piece.
Great. Thank you so much for those examples. So we have one final lightning round question for our panelists before we open it up to you all in the audience for your questions. So in 1 minute approximately, what advice would you give researchers trying to do similar work? And we'll start with Carlos, and then Katie, and then Mary.
Don't do it. It's so tiring. No, I'm just kidding. I'm just joking. I love doing this work. I think building those relationships, those community relationships, whether it's through a community advisory board, whether it's connecting with agencies, whether you are just a member of the community, is crucial for this work. So establishing that, honestly, regardless of methodology, even if it's because you're going to be hearing from the community to get feedback on your survey or your project, is really, really important. And so do that, and do that early. It takes a lot of it takes some time to develop those relationships. You can't just sort of start a research project, just go out there and think you're going to be sort of, connected to the community. So that's really, I think, crucial, and something that, requires time, requires effort. And I think, it's just really important. The other piece of advice is have good colleagues around you. I've been really fortunate that my colleagues and our grad students and our research teams have just, been sort of just really great and very sort of complementary in terms of the skills they bring to the team. This is not work to be done sort of as a sole researcher, solo author type situation. And good colleagues that are going to sort of complement your weaknesses and bring their own strengths to this work has made just a huge difference for us.
No, it's happening because you're supposed to mic transfer to BGH. Let's call it out so we don't stop.
Katie, you're up.
All right. So I would say, unlike Carlos, do it. And specifically do participatory action research. I think it really adds a level of depth and impact to your work that other approaches can't add. For me, it's completely changed the way we do work, the impact of our work on communities, on reducing violence. And it's changed me as a person too. I think the other thing is be persistent. This work is hard, and it takes persistence and patience. Sometimes people say I'm stubborn. I like to just say I'm persistent. But I think that is really important in this work. Leaning on your supports, don't do this work alone. Recognize your positionality. I think that positionality is so critical in this work, along with humility and a sense of humor. Again, I think really thinking about who is your team, and what can your team do together, and make sure that your team includes as co-leaders alongside you, those that you represent or those that you do your research with. So I will leave it at that.
Echoing some of the same sentiments as my panelists, I would definitely say build trust or establish relationships with community leaders or organizations that already work with those particular populations, because trust is very crucial for community engagement or any type of engagement. And again, stressing that this may not happen overnight. It does take a while to build trust and rapport, but I would definitely go with organizations that target those populations. Maybe utilize social media. Everyone today tends to be on social media, specifically for adult, I would say target adult, the adult population, or the hard to reach adult populations, and maybe try pilot studies that can help you. Sometimes they can help you with your research, conducting preliminary studies to test your approach or make necessary adjustments based on the feedback you get from those particular target groups. Today I provide gateways for other researchers to have access to victim population, because they're doing much more research than I'm doing, since I have other roles. But I like to make those connections to other researchers that reach out to me. I'm happy to do that, to assist those scholars in completing their research and basically adding to the body of literature, specifically when it comes to child victims and elder adult victims. So those are some things I just, would like to leave with you.
Wonderful. Thank you all so much for answering my questions. I love hearing how aligned your advice and recommendations are too. And that certainly fits with our mission here at CVR to build relationships and make those connections and support those collaborations in whatever way we can. So flagging that we are having a meetup month in January where we're trying to encourage researchers and practitioners in a community to get to know each other, kind of outside of any proposal or effort, and really just build those connections. So we are going to now turn it over to questions from our audience. My colleague Crystal and I will flag things in the chat, but you can also raise your hand and then unmute if you would like to ask your question out loud. Looks like our first chat question came in about techniques for engaging with research and getting feedback with clients that don't wish to engage with services. Also, will color survivors. Okay. All right. Do any of our panelists want to start with that one?
So I can mention a couple of things, or this is to Brooke's question. So, our research, we don't do service delivery. Our research projects have always been sort of primarily research driven, but we give information about services, given the subject matter, which has usually been violence victimization. We give a lot of information about services, and sort of we after when they're completing the research or when they're part of the project, we just sort of say, here, listen, here's a list of resources relevant to what we're doing, and really sort of let them decide, if they want to engage with anything. Some folks come to us and say, particularly we hear some of this in the qualitative interviews, come and tell us, yeah, I've been doing therapy for a while, so on and so forth. And then some people are like, yeah, this is the first time I ever talked about it. And so we just sort of have a very kind of just neutral stance of, here's information that might be helpful to you given what we're focusing on, and really sort of provide them, information about sort of local resources that might be helpful to them. In terms of, focusing with communities of color and those survivors, again, we've been doing a lot of work with the Latino community, and I think this applies to other sort of communities, which is when you involve individuals from that community in the research process, that's really a sort of great source of information and resource and education around what's unique to that community, what are the sort of experiences that are going to be different for them, and how doing the research is going to be in a way that is more in line and fitting for those communities. But it really is having those individuals being part of your team, being part of the work, that helps inform how to approach the different communities of color when it comes to doing this type of work, particularly given that it's such a sensitive topic and plays out very differently for different individuals in different communities.
Thanks so much. And I see we have a couple requests for resources and readings that are recommended specifically around participatory action research and when doing research with sensitive groups. And I know Katie volunteered to share some reading lists, and I will also say that a little preview, but we are planning to publish and release some suggested reading lists by population areas to accompany, our materials from this event. So that we'll put those together, and then we can also share out some resources around PAR when we share those as well. Right, Bailey, would you like to go next?
Hello, sure. Thank you all for your presentations. It's been really, really insightful. I think my question is most relevant for Dr. Cuevas. So I work at the Police Executive Research Forum. So we work closely with police agencies. Some police agencies have immigrant and refugee liaison officers who work in those communities. Any cautions or suggestions you have on working with those officers to gain access to those communities?
Ooh, let me answer this question from sort of the kind of the other side of the equation. What our research has tended to show is that there's a lot of distrust of the police, and there's a lot of lack of reporting when it comes to formal outlets in general and police in particular. And that's really been, I think that really sort of brings a challenge in terms of sort of connecting to some of the communities through the police, given their role. I think the thing that I have found, and again, this is honestly, this is a little bit more just the fact that I'm in a school of criminology and I've got policing scholars and sort of down the hall. There's just, it's really going to depend on the actual police, unit, if you will, because there's just vast variability in terms of sort of the culture within a police department, which again, very often the leadership makes a difference there. And I think honestly, finding allies within the police that sort of get it and sort of on board with this kind of work has usually been sort of the gateway. So we've had some collaborations with police and sort of other type of research, and it really is about the degree to which the leadership sort of has buy-in in terms of their appreciation for the research, the utility of it, and they're willing to engage with it. That has made the difference whether we're able to do a certain project or be able to sort of work with them and sort of in this sort of type of work. But it's just so different across different, we've had great relationships with some, and then with some, it's like, oof, no, it's not going to happen. Find your allies, I think, is the only advice I would give.
All right, we had a question in the chat about recommendations for reaching the homeless community when conducting research, and particularly for quantitative research. I'm not sure if that is if that is something that the three of you want to address, but I do know that that hopefully we will be able to talk about that a little bit more in the breakout group too.
I mean, this is not my area of expertise, so I'll just say that. In our study with sex trafficking survivors, though, we are targeting like homeless shelters or like soup kitchens, places that feed people who have food insecurity. We're also, and kind of in a lot of our studies, we use snowball sampling, right? Like to really try to have people tell other people, which in our sex trafficking study is actually like one of our most effective methods of recruitment. And then I think also too, like, again, like that hiring within the community. So we have people, on our on our studies who, or on our staff, excuse me, who are survivors. When we're doing work with like system involved youth, we have formerly incarcerated adults that are working with us. So if there's like ways to also think about who might be strategic on your teams in that way, could be helpful. So I don't know if any of that's helpful, but I know for us, we do recruit it shelters and soup kitchens and things like that. And that I know a number of the people that we work with also are struggling with being houseless. So thanks.
Zishan, is that apologies if I mispronounced that. Please feel free to
Yeah. Can you hear me? Yeah. Okay. I'm Zishan. I'm a PhD student in University Cuevas in Malaysia, and I'm working on the role of technology in human trafficking. My studies basically focusing on Pakistan. So recently, I conducted research on victims of human trafficking and experts of human trafficking. So I also collected data from the Journal Public of Pakistan regarding the human trafficking. So I faced several challenges regarding collecting data. So I have a question from Dr. Carlos because he mentioned about the max method. So I'm focusing on max method study. So basically, I also faced several challenges during collecting data from the victims. But apart from this, I also faced some challenges collecting data from Journal Public of Pakistan because I distributed questionnaires in the Journal Public, and majority of them, they didn't believe on me. Like as a researcher, they didn't believe. They have like some doubts on like researchers. So my question is that how we can like we resolve these issues during the collection data from the Journal Public.
So are you referring to doing like a general population survey and having individuals sort of believe in the legitimacy of the survey, the legitimacy of you as a researcher?
I'm a PhD student.
Okay. So
I
is it in part
conduct.
because your early career, that's the challenge? Because you're a
Yes.
student in early career, is that part of the challenge?
Because I'm talking about the data collection. So I faced these challenges during my data collection recently.
But you're saying it's in part because you're still a student, is that correct?
Yeah.
So honestly, I think that's a lot where you really sort of having good mentors who can be supportive and assisting in this is really key. We're going back quite a few years now when I still had brown hair. When I was a graduate student, I did my dissertation was actually on individuals who've committed sex offenses. So needless to say, a group of individuals who are not particularly eager to participate in research and share their experiences. And one of the things that was really sort of crucial in terms of me being able to actually recruit participants were sort of two things. One was the degree to which my mentor was involved in connecting me with agencies, with service providers, so on and so forth. So the role of your mentor, your advisor, whoever you're working with, is really important in terms of them helping facilitate sort of the connection and sort of helping support your work and the legitimacy of your work and all that. And then the other was I had a lot of colleagues who worked in that area. Now that may be different when you're dealing with trying to do sort of a more general population survey, but some of the colleagues that were service providers and were practitioners were also really helpful in helping me vouching for the research that I was doing. And again, that's going to be very different for what I was doing versus what you're trying to do. But I do think your mentors are really the ones who can help overcome this hurdle, because you're not the only one who struggles with this when you're a student, or even when you're early in your career, where you you haven't you don't yet necessarily have sort of the street credibility for doing research. That's where your mentors are really helpful. That's where colleagues are really helpful. So it's really sort of the people that you have around you that can help facilitate this until you're old and gray, and then you don't have as much of a problem with that anymore.
Thank you,
Thank you
Dr.
all for asking the questions, and thank you to our panelists for answering them so thoughtfully. We are at the exciting point in our agenda where we are going to be continuing the discussion in smaller groups. Let me see if I can very quickly share my screen without it being a whole issue. Okay. We're going back and forth. That's always challenging. Okay, so we are going to be splitting into virtual breakout groups led by our 3 panelists, as well as the additional experts listed here. Our facilitators have guiding discussion questions that will explore strategies to build trust with victim survivors, the role of researcher practitioner partnerships, what researchers need to be successful, and how you've seen this work make a difference. So really building on a lot of the themes that keep coming up here. We've made every effort to place you in a group based on the victim population you identified during registration in order to facilitate more relationship building and shared learning. So once in that group, feel free to come on camera and to unmute yourself when you're interested in participating. And then the groups will close out automatically and bring you back into the main room to conclude our event. So we will go ahead and stop there, and Paige, do your magic.
Okay, here we go.
Hi, everyone. Welcome back. We're going to let people trickle back on in while I get my screen sharing back up and running. Hopefully everyone can see that. Excellent. Okay. All right. Well, thank you all for participating in those groups and for coming back with us for our last little bit that we're together today. We hope you had fruitful and engaging conversations with your peers. I don't know about you, but I am very curious to hear how everyone else's groups went. So at this time, I would love to get a few volunteers who might want to come off mute and spend a minute or so sharing any key takeaways or interesting discussion points from your group.
I'm Yolanda. How are you?
Oh,
Our group was focused on older adults of victims, and Jennifer was running it. So what I got a couple of good uh things that we can work on. I did not know that the older adults can have a safe place to go called the Dove program. So I'm gonna have to look into that. I thought I'd share that with everyone so that if there are older adults that need a place to go, a Dove program is a really good place to go. But we talked a lot about the limitations that they have. Like for instance, they may have dementia and physical limitations. Maybe not have enough people to come to visit or communicate with them so that they can share their experiences and what their needs are. But I know that Jennifer does a good job in her community where she goes to other people in the neighborhood along with her own family members, where she shares and helps, and get their information. So that's a good thing that we talked about. And it makes you think, I do the same thing with my neighbors too, but I don't get too much into, but it's good to talk because we need to know how they can get the shame removed and, so that they can communicate and see what their needs are. We talked about strategies, and the research that is being how to get people to come together to do the research properly and get all the information that you might need for yours. Let me see. Um, Building a bridge with these other agencies that can give you good statistics on their information, and county agencies as well. Let's see, building recruitment and community members and participation with research was spoke of, and also one of the young ladies spoke of making sure that the people get to tell their story the way they want to tell their story and their own experience, and to give them the autonomy to speak or not to speak about it as well, and to feel and get them to feel safe in their environment so that they can share. That's what we spoke about.
thank you so much for sharing. I appreciate that. And it sounds like there will be a lot of similar things. Susan, did you want to share?
Yes, I'm just going to share quickly. I wish we'd had 3 times the amount of time that we had. One of the most important points that came out in our group was the need to be flexible about working with practitioners and building trust with victims and survivors, because sometimes you're only serving a victim or survivor for a very short period of time, during an acute phase. Or one particular issue came up in trying to engage victims in focus groups or interviews where they don't show up for a time that they had previously scheduled, and then they feel shame. So making sure that you are messaging that there is no blame, that life happens, and that people can join a later drop-in session. I just loved that tip, but really being flexible was key. And then there were a lot of tips about building trust over time through activities such as pulling articles that a practitioner needed, having regular team meetings. Let me see, where were some of those other articles? Just being on hand, having the practitioner weigh in on research questions, because they really understand the long game more than the researcher may. And so there's a lot more, but I'll stop now. You said 1 minute.
Appreciate that. Thank you so much. Anyone want to go next?
So I'm Elisa, and I think, Mallory, I was in your team with another beautiful lady, and the group 6 came up with a couple of things about how to eliminate the barriers with qualitative and quantitative research. And she was talking about how to increase the domestic violence in Philadelphia with the design of products. And they engaged 9 different languages and low literacy clients to minimize the barriers were important, the use of technology and the lack of transportation in the community. So she was going out to the community and did all that progress. There was also an intervention about death survivors, and their participation was to design videos that had embedded visuals to make it accessible for that community rather than hearing they could visualize. And most of the people wanted the clients to feel comfortable and approachable and to adapt the materials to make materials more accessible. Then we went to Courtney in Cleveland, who's doing amazing work with older adults and address accessibility and support to those supporting. I don't know if I convey the pearls of wisdom from group number 6, but I thought we missed financial abuse and intimate abuse.
Yeah, thank you so much for sharing. And yes, those were excellent highlights from our conversation, and a lot of alignment with what Crystal put in the chat from their group focused on immigrant victims, where, you know, this emphasis on building trust, taking the time, having multiple languages and shared backgrounds involved in the research team. Yeah, and I love that emphasis on flexibility with practitioners around recruitment and figuring out some of those supportive pieces for those relationships and getting buy-in. And it seems like okay. Yeah, more excellent examples about authentically connecting with survivors in research and building relationships with practitioners. Is there anybody else who wants to come off mute and share any key takeaways or themes?
Mallory, I'm happy to give a little update from the Native Victims group. We did talk a lot about making sure that the research is relevant and sort of beneficial to the community that you're working with. In other words, like, try to have some reciprocity in your work. So, hey, I'm going to do focus groups over here on this topic. Is there anything that, you know, the elders or the council members or folks from your coalition are really interested in knowing about? We can ask a couple of those questions as well. I think the being genuine is an important one, right? Like, you need to understand or try to learn. Katie talked about this a lot, you know, being quiet and listening and learning authentically about the role of culture, the role of spirituality, you know, things like that in these unique communities. And how do those things play into or impact any of the research questions that you are asking? And how can your research questions inform things about those? So I think reciprocity was really important. And then we talked about the value of working with folks sort of on the ground in the community, who are embedded in the community. Maybe it's the coalitions, maybe it's your victim service providers, you know, something like that, because they know the community so well. They might be working with some of your participants on an ongoing basis, right? They can help with supports, especially when we talk about, you know, the aftermath of victimization, right? There's special needs that it comes with that. So anyway, those were some of the highlights from the Native groups discussions.
Thanks so much, Emily. And it looks like we got some other great examples from Bree in one of the youth groups, particularly compensating the survivors who are participating. Love that. That's so important. I think kind of across the board is recognizing the expertise of people with lived experience and who are contributing to studies, whether in a advisory capacity or in as a researcher or as a participant, and making sure that that there's direct benefit there as well. Right, I think we have maybe time for one more share out if anybody is interested, but also we can go ahead and move on if people feel like that what's been said already in the chat is capturing kind of the key essence of your conversations.
Valerie, this is Evelyn. I wanted to jump in and just quickly share that there was an interest from folks who attended our session and where they could find data on incarcerated survivors. And so we had Elizabeth from NIJ there, which was really helpful to talk about the different federal resources, but I also wanted to drop a link to ICPSR, which is where research teams are required to archive all of their data funded by federal projects. And so that could be a place where people can go to do secondary analysis and access that data.
Love that. Thank you so much, Evelyn, for raising that. I'm so glad that that was something that that you all discussed in your group, and that you shared it with everybody else. I think that is an excellent and very underused resource for finding data and exploring new questions. All right, and it sounds like Susan's group talked about the difficulties of building participation in online formats. Yeah. Absolutely. Awesome. Well, thank you guys so much. And at this point, I invite everybody to post in the chat what insights from today you think might be most applicable to your work, while I share briefly a few of the next steps that'll come from this. So we will be synthesizing the content from the panel and the breakout groups into a written brief that will include examples of some of the research shared, gaps and challenges identified, and strategies and recommendations for researchers, but also for practitioners and policymakers. You know, we know that obviously we've been talking a lot about the importance of those practitioner-researcher relationships, and then it's, you know, so important to have funder support for research that that takes into consideration these challenges, these partnerships, these needs. And we also plan, as I mentioned, to publish accompanying suggested reading lists of primarily open access materials by population of focus. And we'll share those along with the brief when they're completed, as well as the recording and slides from today. So yes, and then I know there was some discussion of sharing research and resources around participatory action research. So that is maybe something that we can pull together for everybody as well. And again, thank you, Katie, for volunteering some insights on that. All right, and then lastly, before we adjourn today, I want to highlight just a few of the ways that CVR can help foster and uplift this type of essential research. And the partnerships that are important to facilitate that. So we believe that victim research requires really strong researcher-practitioner partnerships, and I know that has been a key theme throughout today. And we at CVR offer a one-of-a-kind researcher directory to facilitate finding research partners. So please feel free to give a thumbs up if you are already in the directory, or if you've used it to find a research partner. But if you're not, I encourage you to check it out. My colleague, Crystal, I believe, is going to post a link to the intake form for researchers who would like to go ahead and sign up. And then we'll also include a link to just the general directory page where, if you're a practitioner or a funder, you can search for researchers by state, by population of focus, by type of research done, all of that. And then we've also produced tools to support these partnerships, like quick reference guides on creating MOUs and victim protecting victims in research. And then additionally, I've mentioned our library of open access research. We have research syntheses, and generally encourage you to check out the website here. All right, so then very quickly before we sign off today, it would be really helpful for us to get feedback from you all on how today went to inform some of our future events. So Susan will be putting a link in the chat to our feedback form. Should only take 1 minute of your time. And then you can also request a certificate of attendance by entering your email address where indicated in the form. So with that, I would like to conclude by thanking our panelists as well as our discussion group leaders for their insight and contributions, and thank all of you for taking the time to meet with us today. I hope you've been able to share some work, make new connections, and that these conversations continue. So thank you, and I hope you all have a wonderful day.